I'm Dr. Rod Pearce. I'm a general practitioner. I have the privilege of looking after many patients, some of them vulnerable, some of them proudly coping with a disability they've been born with. I had a patient who had cerebral palsy. He was a diabetic, but otherwise he lived independently. His family supported him and he grew up and he was able to live essentially an independent life. But he had a network of support that was largely hidden to any casual observer. But behind the scenes he was well supported, he knew what he was doing, had a good routine, was able to work, able to go and see his family, but he tried to become independent. On one such occasion, he was found on a park bench. He was unkept. He seemed like he was just an alcoholic sitting on a bench, and people walked past him. If only they'd scanned in and seen that because of his diabetes, because of his sugar, because of an unusual set of circumstances when he got confused, got lost, and because of that disorientation, he appeared helpless, dishevelled, and a totally different character. And he was being treated as someone on the bench that wanted to be there and should be left there. He was eventually retrieved, went to one of the emergency departments, and it took 3 years to get him back to his normal life again. If only someone had looked and scanned and quickly seen all of the relevant past history, all of the care that had gone into what was essentially an independent and a functioning, well-loved person. The ID can be time critical, can save his life, and he doesn't have to end in that sort of situation. It can save lives. If only people were wearing them, if only people looked.